to Next Round with the Pacific Research Institute. I'm your host, Rowena Ichon. In this podcast, Tim Anaya, PRI's Director of Communications, and I welcome back President and CEO Sally Pipes. The presidential campaign has begun to heat up, and the candidates are staking their position on healthcare. Recently, Bernie Sanders fired the first shot with his version of Medicare for All. In this podcast, Sally evaluates the players, the plans, and the politics of healthcare. Thanks for joining us. Welcome back to Next Round, Sally.
Thank you. Delighted. There's a lot going on in healthcare. There is no lack of topics to discuss as 20 Democrats have now, the latest being Joe Biden, entered the race to become the Democratic nominee for president.
I know. And let's start off with talking about Senator Bernie Sanders. And as you know, he recently came out with Medicare for All, his version 2.0. So how does it differ from the first? And while it's hard to think about single payer as being good for America, do you think this version is an improvement over the first, or is it even worse?
Well, actually, this is the third version. His first version was not a bill, but it was a plan for a single payer, which he used in his debates against Hillary Clinton when they were in the race to get the Democratic nomination. And as you know, Mrs. Clinton got the nomination, not Bernie Sanders. Then in 2017, he introduced his Senate bill for single payer, and then that didn't go anywhere. But his new bill, S1129, he introduced on April 10th. It's a slightly more comprehensive version than his 2017 bill because it includes for free long-term care, which would be delivered in people's homes or in a community setting. So this is something additionally he's added. I think he added it because Pramila Jayapal, the House member from Washington State, in her single-payer bill that she introduced a few months ago in February, she actually included free long-term care. So I think he felt that he had to do that too. So that is going to add to the cost of his single-payer bill. And it's noteworthy that his single-payer bills and Pramila Jayapal's bill include more comprehensive procedures than in Canada's single-payer healthcare system because they have added free dental care, free drugs, free vision care, and free hearing care. Those are not included in the Canadian system. So when you look at his 2017 Senate bill, which was costed out by Charles Bleyhouse at the Mercatus Center at $32 trillion over 10 years, $3.2 trillion a year, this new bill, S1129, is going to be even more expensive than $32 trillion over 10 years. And as we all know, no government plan, bill, legislation ever costs what people estimate, because when people think something's free, they demand a lot more of it. So this is going to be very, very expensive.
Already many of Bernie's rivals for the Democratic nomination, Kirsten Gillibrand, Kamala Harris, Elizabeth Warren, and Cory Booker, have signed on to his plan in the Senate. But clearly many progressive presidential hopefuls think that single payer is their ticket to the White House. Do you think this is the case?
Well, it's very disconcerting to me that this has really become, I think, the litmus test for the 2020 presidential election. In this latest Senate bill from Bernie Sanders, he has several co-sponsors, including 4 who were in the race for president, as you mentioned, and the same 4 who backed his 2017 bill. Senators Harris from California, Gillibrand from New York, Booker from New Jersey, and Elizabeth Warren, of course, from Massachusetts. I think with 20 candidates now in the race, many of them pushing for single payer or Medicare for all. These, of course, are the extremely progressive liberal candidates. As we saw on April 25th, former Vice President Joe Biden became the 20th candidate in the race. We haven't heard where he's going to come out on Medicare for all or a stepping stone approach to Medicare for all, which a number of the other candidates in the race, declared candidates, have come out with stepping stone approaches to a single payer, i.e. Medicare X, Medicaid for all, Medicare for America, Medicare buy-in at age 50. These are all plans that would crowd out eventually private coverage and end up with a single payer system. But I think it's going to be a huge, and I think it is the major issue coming up in the 2020 presidential election. But of course, Senator Bernie Sanders has been on this on this role about single payer for many, many years. It's amazing how vocal he is and how he screams out, single payer is the answer. And I think, if you listen to his Fox News town hall from a couple of weeks ago, all of these people that were in the audience were cheering when he said healthcare is a right. Everybody will have full health coverage and there will be no private insurers. But no one on that show was there to say, wait a minute, what does Medicare for all mean for you as a patient? They should have had somebody talking about what the Canadian system means for people's healthcare, what the National Health Service in Britain means, long waits for care, ration care, high taxes, high hidden taxes, and of course shortages of doctors and of the latest medical equipment.
As you mentioned, it seems that the progressives who are pro-single payer are dominating the headlines, but there are still some elements in the Democratic Party who think Medicare for all is just too expensive, namely Speaker Nancy Pelosi. How do you think this rivalry between the more radical wing of the Democratic Party versus the moderates will play out?
Well, it's a bit early to tell, but yes, many of the old guard, notwithstanding Senator Bernie Sanders, many of the old guard in the Democratic Party, including Speaker Nancy Pelosi, because the Democrats now control the House, she has come out and said we cannot go for Medicare for all. It would be too expensive. She even made that quote in Rolling Stone magazine. She said, how are we going to pay for that? And she mentioned $32 trillion over 10 years. But I think it's going to be a big fight within these two branches. And the younger members in the House and the Senate and younger members who are vying for the Democratic nomination, they are progressive liberals. Many are members of Democratic Socialists of America. They are pushing for an agenda, whether it's healthcare, the government takeover, whether it's free college education. All of these things, they are pushing for an America which is an entitlement society. So it's unclear how it's going to turn out. But I think, I find it odd to say, I have to say that at least Nancy Pelosi realizes that this would be very, very expensive, and how would America afford it? So we shall see. But I think, as I say, I think it's going to be the issue in 2020. And you have people like the first-time House member Alexandria Ocasio-Cortez, who is very much in favor of all of these progressive ideas, and one, of course, being Medicare for all, single payer.
In some polls, Democrats and sadly even some Republicans support single-payer health care. But you also see when Americans learn about what it entails, things like the end of their employer coverage and higher taxes, they're thinking twice. So given this fact, you've argued that Medicare for all will never, ever become law. So can you talk about some of its failings, particularly what we're seeing patients facing in Canada and in the UK?
Well, the latest Kaiser Health poll showed that 71% of the people that they polled supported Medicare for all and the fact that health care should be a right for all Americans. Now, that's a very disturbing number, and there were some Republicans, signed on to they like Medicare for all. But when you take into account the higher taxes that would be necessary and the fact that Americans would lose their private employer-based coverage because there would be no private coverage for anything deemed medically necessary, which is virtually everything except for LASIK surgery and cosmetic surgery. That support number goes down both in terms of how people support tax increases and losing their private coverage. And that number drops down to 37% in both cases. So this is the big issue that Americans, it sounds great. Doesn't it sound wonderful that something will be free and everybody will be covered and everybody will get top-notch care? Well, you have to look no further than north to Canada, which is where I'm from, to look at their Medicare system, which became fully operational in 1984 under the Canada Health Act. But the whole process of taking over the healthcare system by the government started in Canada in 1947 under then Socialist Premier of Saskatchewan, Tommy Douglas, who was named the greatest Canadian by the Canadian Broadcasting Corporation, our government-controlled broadcasting system. He was named the greatest Canadian for his foresight to see that Canada would disallow any private coverage and everybody would be covered under Medicare for all. So in 2018, this is something that people in America need to understand. In 2018, Canadians face a waiting time from seeing a primary care doctor to getting treatment by a specialist of 19.8 weeks. That's over almost 5 months. If you need an MRI, if you think you have a brain tumor or something, to have to wait, many, many months to get an MRI. It's just not right. And so Canada has a small population, about 37 million people, fewer than in the state of California. But according to the latest stat from one of the think tanks in Canada, about 200,000 Canadians now go abroad to seek and pay out of pocket for treatments that they feel that almost 5-month waiting time is too long. And of course, many waits, are longer than 5 months. Some are a bit shorter, but it is very, very important. In the UK, under the National Health Service, which is turning 71 this July, 71 years old, there are over 4 million Brits on waiting lists, and over 200,000 are waiting 6 months or more to get the kind of treatment or appointment that they need. So you have long wait in both Britain and Canada. In Canada, if you are a senior, and this is something that Sanders says, our seniors love the Medicare system. Well, we just heard from the Medicare trustees that Medicare Part A, the hospital part, will be bankrupt by 2026. So when Sanders says, we're going to put everyone onto a Medicare system like the Medicare system that we have, if it's going bankrupt in 2026, how can we add another almost 300 million people to a system that isn't financially viable? So that is a huge problem. We also know that in Canada, care is rationed, so that if you are a senior, you are less likely to get treatment quickly because the government takes care of people who are younger, who have serious problems, and at the expense of seniors. In the UK, the National Health Service has a program called QALY under the National Institutes for Health and Clinical Excellence. What NICE does is it works out what is the actual value of your life in terms of money and what is the cost of the treatment that you need to receive. If the value of your life is worth fewer dollars than the cost of the treatment, then you will be denied that care. So these are the kinds of things that happen, under single payer. And I think Americans need to understand that. We have almost 10,000 people a day, baby boomers, who are reaching age 65 now and will be added to the Medicare roll. And so this is very, very important that people realize that if they think they have to wait under the Medicare system now, it's going to be far worse for our seniors, but not just for our seniors, for everyone in America.
Sally, Alexandria Ocasio-Cortez, or AOC, said that a great example of Medicare for all is the VA system. It's amazing that she believes this, since the VA has been under fire for so many years for the poor care our vets have been receiving. Debunk some of the things that AOC is saying about the VA system, and by holding up the VA as an example, don't you think that she's simply undermining the argument for single payer?
It's interesting that she came out at a town hall in New York recently saying her new idea, her new model for healthcare reform, single payer, is she's calling it the VA for all, because as we know, the Veterans Administration is a single payer system. She says, if it ain't broke, don't fix it. The VA provides top-notch care. Well, I don't know whether she doesn't read or she reads and doesn't take in the fact that the Veterans Administration, the VA system, has been under a lot of criticism since 2014 when it came out that there are long waits for vets to get their care. Many vets have died on the waiting list. There's been fraud in terms of reporting the waiting list. So there's a lot that, the VA is a single payer system, which is denying care to our vets. And one of the more recent additions to the Democratic primary nomination is a chap from Massachusetts, Seth Moulton, Democratic House member from Massachusetts. And he just came out against what Ms. Ocasio-Cortez has said, and said he is a socialist, he's a Democrat, but he is not for single-payer health care. He is a part of the VA, and he made it very clear that, the quality of the VA system is not great, and he would not ask Americans to give up their private health care because he knows that the VA, a single-payer system, is not providing the best health care for our vets. And certainly it's interesting that Ms. Ocasio-Cortez does not seem to see this, but I think the American people understand that.
In another case of a food fight among progressives, in New York, the unions are preparing to battle against the New York Health Act, which is New York's version of Medicare for all. So in this break from their traditional allies, why are the unions fighting single payer in this state?
Well, the New York Health Act has been introduced for many years in New York State and has never really gone anywhere. In particular because while the Democrats controlled the Assembly in New York State, they didn't control the Senate. But in the election in the fall of 2018, the Democrats also took control of the Senate. So those people behind the New York Health Act are just dancing in the streets because Assemblyman Richard Gottfried and New York Senator Ricardo Rivera, the chief sponsors of the New York Health Act, are now thinking that they are going to be able to pass this New York Health Act. And it's already passed one of the committees in New York State. I think even if it does pass the Assembly and the Senate and the bill goes to Governor Cuomo's desk, I would not be surprised if he vetoed it, because he has said publicly that while he supports the idea of a single-payer healthcare system, he thinks it should be a federal or a national issue and not one at the state. So that may be his cover, but he definitely is not in favor of New York State being the first or the second, if California were to do that, state to have a single-payer system. I think also, the people, the public servants in New York State, the union members, have come out and said they're very concerned about losing their very generous healthcare plans that they receive through their unions. I mean, they have obviously read some of the things that have happened to people in Canada with the long waits, the ration care, higher taxes, and they're very nervous about losing these tremendous benefits that they get through their union, particularly those who are in the government union. It's interesting in New York State that revenue coming into the state in 2020 is estimated to be $90 billion, but this single-payer bill from Gottfried and Ricardo was costed out by Rand at about $139 billion that would be needed in tax revenue in 2020. With this new bill, what has happened is that they have added in the whole idea of long-term care and home support services, just like Senator Sanders has done in his 2019 bill. So if you add in that cost, you're probably going to bring in a lot more cost, which would up the cost from $139 billion under the old New York Health Act to about $160 billion. And as I said, the state is only bringing in $90 billion. So if this were to go ahead, it would mean tremendous tax increases for the people of New York. And as we saw in Vermont back in 2014, Vermont Governor Shumlin had signed a single-payer bill into law in 2011. And in December of 2014, he had to reverse it and veto it because he realized that the tax increases would be so great for the people of Vermont that they couldn't afford it. So, in New York State, I'm sure Governor Cuomo realizes that the tax implications of this New York Health Act would just be so onerous. Plus, I think that, having public sector union members, feel that this would be a disaster for them and the great health care that they receive. This puts up more block against this bill, which, as I say, may actually pass the Assembly and the Senate, but I think would be vetoed by Governor Cuomo based on his previous comment.
Sally, you also argue in one of your op-eds that you think that women might actually turn out to be dissenters of Medicare for All. What's your rationale in this case?
Well, I think that women, and particularly mothers, are going to be very upset with if we were to get single payer in this country. If Bernie's bill, if he were to become the presidential nominee and if he were to win the presidency, I think mothers are very concerned about the health that their children get, and I think they would be upset that care would be denied. And when your child is ill, you want to be able to have access to the best care and the best pediatricians. And so if you have long waits for care, in particular, Senator Sanders says there would be no referrals to specialists. Well, referrals to specialists are a key component of a single-payer healthcare system in Canada and the UK. You don't call up your cardiologist or your neurosurgeon or your ophthalmologist. You have to go to a primary care doctor first and then wait to get the appointment with a specialist. So if you're a young mother with a child with an illness and it's not something just like a sore throat or, a case of the measles, for example, and you think you need specialist care, mothers are going to be very upset because they're not going to want to face these long waiting times because it will be harmful to their child's health. I had a piece in Fortune last year talking about single payer and then comparing it to the Canadian system, and this piece, which ran in Fortune magazine, elicited a lot of response, and in particular from a woman in Des Moines, Iowa, a mother who had a child with special needs. She belongs to a special chat group, and when there are Canadian mothers that are on the chat group, and they talked about how terrible it is for their children because they can't get the kind of care in Canada and prompt care that children in the U.S. get through the private healthcare system. And this mother said it's just so important that we don't have a complete government takeover of our healthcare system, because it will be so harmful, particularly to mothers with children with special needs.
So here in California, Governor Newsom campaigned on a platform of bringing Medicare for all to the state, and he enjoyed the support, of course, of the nurses union during his campaign. Yet there hasn't been any single-payer legislation introduced this session, and Governor Newsom's efforts have been focused on prescription drugs. So how do you assess the governor's actions on health care so far? Was his single-payer embrace just phony campaign rhetoric, or do you see him as incrementally laying the groundwork for a government health care takeover?
Well, there's no question that Governor Newsom, when he was running for the governorship, he came out boldly and said he supported Medicare for all or single payer. And as you say, I think one of the reasons for this was he wanted to get the nurses, particularly the members of National Nurses United, who are very strong proponents of single payer. Actually, they're militant in their support for single payer. So he came out and said that he supported it, and the nurses supported him. Following his inauguration in January of 2019, as you say, he's been very quiet on the idea of, passing single payer legislation if a bill were to come to his desk. But to date, no bill, is even being debated, as far as I know, in the Senate or in the California Assembly. He has, of course, come out with a few ideas, which I think are probably in his mind. He's hoping that they will placate the nurses and many other people who supported him in the single payer idea. One of them, of course, is that the California state government would be able to negotiate drug prices with drug companies, and so that drugs would be much cheaper in the state of California. And of course, as we all know, this is a disaster because it would bring in price controls, and it would have a negative impact on the research and development into new treatment drugs, biologics, that America is so famous for, because this kind of research and development innovation does not happen in other countries that have price controls. So he is a big proponent of the government getting into the act and dictating what prices will be paid for drugs. So that is one of his pillars of his work that he is doing on healthcare. The second one is that he believes that illegal immigrants in California, who currently are eligible for Medi-Cal, our version of this Medicaid program for low-income individuals, illegal immigrants in California can sign up for Medi-Cal up to the age of 19. He wants to increase that age from 19 up to the age of 26, which would bring about an additional $200 million cost to the budget of California. Another thing he wants to do is to bring in a state individual mandate, which would mean that if in the state of California, you would have to pay a penalty, or if you could not prove that you had health coverage. His penalty would be even more onerous than the federal mandate that just ended on January 1st of 2019, which under Obamacare was $695 or 2.5% of income, whichever is greater. Here in California, his individual mandate would be even more onerous, as he would charge $695 per adult and $348 per child, up to a maximum of $2,085 or 2.5% of income, whichever is greater. So, he is talking about a much more expensive penalty for not having coverage and for that individual mandate penalty. The third thing is that he thinks the subsidies for lower income people to get coverage, he's raising that to 6 times the federal poverty level. The federal, under Obamacare, the federal law is 4 times or 400% of the federal poverty level. So if this were to happen in California, that would mean an average family would be eligible for a subsidy up to $98,000 a year. And the average income in California today is about $70,000 a year. So this would be extremely expensive, would also cost an additional $200 million, $250 million. The Governor Newsom believed that by having the individual mandate penalty, that a lot of people will forego coverage. Therefore, he's going to bring in about an extra $500 million in the mandate penalty to cover increasing the age of people that are illegal immigrants to get Medi-Cal, and second, to raise those subsidy rates to 6 times the federal poverty level, which is about $98,000 for a family of 4.
So let's turn from politics and policy to a more philosophical question. Is healthcare a right? Now, this is a burning issue right now in the public square. Discuss why you think healthcare is not a right, and how do you distinguish the so-called right to healthcare from other rights that we have, like free speech, equal protection, and the rights found in the Constitution and the Bill of Rights?
Well, of course, this whole idea of healthcare being a right, not a privilege, has been a rallying cry of Senator Sanders for many, many years, but particularly as he's focused starting in 2016 with his big push for single-payer healthcare, which, of course, now is, as he says, it is not a fringe issue, it's in the mainstream. So he is out on the stump screaming it to audiences, healthcare is a right, it is not a privilege. Now, under our Constitution, Americans have a right to life, liberty, and the pursuit of happiness. I think this whole issue that Sanders is talking about healthcare being a right, is part of the broad policy ideas, political ideas, where government should be in charge of almost everything. Therefore, healthcare would be a right, free education would be a right, free medical school would be a right. But how do you determine how far that right can go? I mean, Americans, if healthcare is a right, I think it's more important than that Americans have a right to food. We can't live if we don't have food. So I think it's all part of this issue of government taking over our lives. And, as Kevin Williamson wrote so well in National Review, I mean, he said that the notion of citizenship should be one that holds, as ours once did, that among the first duties of a citizen is to provide for himself and to look after his family, not to burden his neighbors unnecessarily. But the rhetoric of benefits as right cultivates just the opposite attitude, one of learned helplessness, not in response to extraordinary challenges, but in the face of ordinary business of life. So that attitude of us all being helpless is of great benefit to a certain stripe of politicians, such as Bernie Sanders and Alexandria Ocasio-Cortez. But this is not good for the people of America or for our country. We have a right to life, liberty, and pursuit of happiness. We don't have the right for the government to be in charge of everything and to take over how we run our lives. Remember, several years ago, Hillary Clinton wrote a book called It Takes a Village. Many of these people believe that village is government and government should be in charge. But we have to make the case healthcare is not a right. We have a right to access to healthcare. And even Howard Schultz, the chairman of Starbucks, who was talking about making an independent run for the presidency, he even came out and said healthcare is not a right. We have a right to access healthcare. We don't have a right for it to be provided by the government. We do have programs within the government, both at the federal level and the state level, which does take care of those people who can't take care of themselves. We have Medicare for people age 65 and over. We have Medicaid, the program for low-income individuals, which now covers about 76 million Americans because of the expansion that was made possible under Obamacare. We have the CHIP program for children. And, of course, we have the Veterans Administration, which is not providing the best of care, as we've talked about, for our vets, and it is a single-payer system.
Finally, Sally, back in the day, single-payer was supported really only by extreme leftists, but now it's become part of the mainstream political debate. And really the fact that so many in this country support Medicare for all is astonishing and shows that PRI has its work cut out. Now, you have a new book that will be coming out next year. Tell us how you think this book will help educate the American people.
In January of 2020, Encounter Books is going to be publishing my new paperback book called False Premise, False Promise, The Disastrous Reality of Medicare for All. And in that book, I'm going to be talking about all of the plans that are out there, which we're talking about now, from Medicare for All going to the stepping stone approaches, Medicare for America, Medicaid for all of these things. But I will be pointing out why these programs are going to be harmful to the health of all Americans. I'm going to use Canada and its many examples of disastrous care and how people die on waiting lists. I'll talk about the UK and the 70-year-old National Health Service, where they have long waits for care. There are financial problems. In fact, in Great Britain, they do allow private health care, and about 10% of Brits do access their private coverage when they feel that the waiting time under the National Health Service is too long. But my real point is I'm going to be working nonstop, educating Americans on why this would be a disastrous reality, because there aren't enough people on our side making the case for how much a Medicare program for all would cost, how we'd have to face tremendous tax increases, how there would be long waits for care would be rationed, and just like in Canada and the UK, there would be a doctor shortage. The best and brightest kids will not go into medicine because under these Medicare for all plans, doctors would be paid Medicare rates, which are 40% below what they get paid for treating patients with private coverage. And the American Association of Medical Colleges has just come out with a new number saying that about 122,000 doctors will retire early by 2026 if we do get a single-payer healthcare system. So the message has to go out to the American people in a way that they can understand. It has to be put in simple terms, and that is what my responsibility is, educating Americans why this is the last thing that they want. We can get to universal coverage if we offer universal choice. America is all about competition and choice, and we need to make that case that is the best plan for our healthcare system, not a full government takeover.
I look forward to reading your new book. Thanks, Sally.
Thank you.
From Sally Pipes, Tim and I, and myself, thanks for joining us. To read more on our healthcare work, go to PRI's website at pacificresearch.org. We've also just launched a new website, the Center for Medical Economics and Innovation, CMEI, your go-to website on pharmaceutical issues. You can visit CMEI at medecon.org. That's medecon.org. If you're working on your vacation plans, consider mixing policy and cruising. Join PRI and the Claremont Institute for our joint 40th anniversary cruise on the Mediterranean. The cruise starts in Barcelona and ends in Rome with a special tour of the Vatican. Special guests include Andrew Roberts, author of Churchill Walking with Destiny, and will include our own Sally Pipe. For more details, visit ci-pri.com. If you like this episode, please tell your friends and subscribe to PRI's podcasts at iTunes, Google Play, Stitcher, or TuneIn. And please do us a favor and give us 5 stars. You can also listen to our podcast on PRI's YouTube page, youtube.com/Pacific Research 1. That's the number 1. Thanks for listening. I'm Rowena Itchon. We hope you'll come back again for next round with PRI.